Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Sign, symptoms and uses of Homeo-REMEDY. Dulcamara. Full name Dulcamara, common name bittersweet. Short name Dulcamara. Source plant vegetable world. Pathogenesis. It causes glandular enlargement, especially in lymphatic system, cellular effusion, and produces skin eruptions. It also produces catarrhal inflammation of mucous membrane and skin, resulting profuse secretion of mucous membrane and skin. Relation with heat and cold, neither chilly nor hot, but prone to be affected by sudden change from heat to cold or from cold to wet rainy weather. That is, change of weather, particularly from cold to rainy weather or heat to cold, they are affected. Constitution specially suited to persons of phlegmatic scrofulous constitution. Temperament to irritable, miasm, sura, psychosis. Mental generals of Dulcamara. Confusion, cannot find the right word, cannot concentrate their thoughts. Reject what was asked for. Depression, scold without being angry. Prone to be delirious in pain, difficult in speaking. Physical generals of Dulcamara. A very useful remedy for persons who are prone to catarrhal, rheumatic, herpetic affection on account of exposure to cold and damp. Affects mucous membrane producing excessive secretion, especially bronchi, bladder and eyes. Mind these three areas: bronchi, bladder and eyes. The mucous membrane of these three places are specially affected in Dulcamara. Stiffness and numbness, aching and soreness of muscles on every exposure to cold, especially back and loin. Every cold settles in eyes, throat, affects the bladder, respiration and bowels. Skin affections liable to appear before menses, enlarged glands. Paralytic effect of single parts like vocal cords, tongue, etc. Paralyzed parts are icy cold, tearing pains. Griping in bowels around the umbilicus, intestines. One-sided spasms with loss of speech. Dropsy, anasarca, exostosis, hemorrhages, bloody, watery or bright red. Mind this two terms, dropsy and anasarca. This is anasarca. This is dropsy. Now what is the difference? In anasarca, there is swelling, that is dropsical swelling of whole body. That is accumulation of fluid on tissue space of the whole body is anasarca. Dropsy is generally localized, leg, hands, face. So this is also water accumulation, but this is localized, this is general. But both are dropsy. General modalities. Worse, being chilled while hot, sudden change of temperature, cold wet, cold drinks, ice cream, damp ground, cellars, beds. Cold to feet, suppressed discharges, eruptions, sweat, autumn, night, rest, injuries, before storm, uncovering, hot days and cold nights, better, moving about, warmth, dry weather. Head symptom Dulcamara. Occiput feels large, cold sensation as if a board were pressing against the forehead. Headache felt better from conversation. Ringworm of scalp, scald head. Thick brown crust, bleeding when scratched, causing hair to fall out, as if hair stood on end. Eye symptoms of Dulcamara. Aching when reading, ophthalmia from catching cold. Paralysis of upper eyelid, thick yellow discharge, twitching eyelids in cold air. Ear symptoms of Dulcamara. Ache with nausea whole night, preventing sleep. After measles, swelling of parotids with buzzing in ears. Nose symptoms in Dulcamara. Aching in nose, dry or profuse coryza. Coryza of newborn. Stuff off in cold rain. Summer colds with diarrhea. Least cold air stops nose. Want to keep it warm with hot wet clothes. Nose bleeds in place of menses. Face symptoms of Dulcamara. thick yellow brown crusts on face, tearing in cheeks extending to ear, orbit and jaw, preceded by coldness of parts and attended with canine hunger. Very, very interesting symptom. Tearing in cheeks, extending to ear, orbit, jaw, preceded by coldness of parts and attended with canine hunger. Facial neuralgia on the right hand side. This picture has been shown. Facial neuralgia presumably actually trigeminal neuralgia. Trigeminal, this is one of the cranial nerves. There are 10 cranial nerves in human body. One of them is trigeminal, and it serves the trigeminal, since it is divided into 3 parts. This is look at the picture. One part supplies the forehead, another is cheek, another the lower jaw. So this is trigeminal nerve. This neuralgia is tremendously painful, so painful that it has got another name, suicide disease. Because of this pain, a lot of person used to commit suicide in older days. Now advanced medicine is there, so sufferings has lessened. Cold sores on lips, warts and eruption on face, twitching of lips in cold air. Mouth symptom Dulcamara, distorted, drawn to one side. Urinary symptom Dulcamara, urine alternately profuse and scanty. Tongue swollen, hindering speech. Paralyzed, that is paralyzed tongue. Inarticulate or difficult speech. Saliva tenacious, ropey with toothache. Throat symptoms of Dulcamara. Pressure as if uvula were too long. Tonsillitis even from every cold. Tonsillitis from every cold. This is the picture of tonsillitis. These are two tonsils. These are enlarged. An inflammation is there. Pus has been accumulated. From every cold. Stomach symptoms Dulcamara. Aversion to foods. Great thirst for cold drinks. Nausea with desire for stool. Shivering while vomiting. Eructations with shuddering. Abdomen symptoms of Dulcamara. Cutting pain at navel followed by painful green slimy stools. Diarrhea, shower watery stools. Worse at night, summer damp cold weather. That is worse at night and worse also in summer damp cold weather. Bowels cold, eruptions or pain about navel. Urinary symptoms of Dulcamara. Frequent urination, cystitis. Cystitis is inflammation of the bladder. Strangury, painful urination. Retention of urine from cold or cold drinks. Involuntary urination from paralysis of bladder. Urine cloudy, slimy, foul. Nephritis, kidney inflammation. Nephrite from cold, bladder or wall thickened. Male genital symptom of Dulcamara. Enlarged testes with griping pain. Impotence. Herpes prepucialis. That is on prepuce of the penis. Prepuce of the penis, herpes on the prepuce of the penis, that is herpes prepucialis. This is a picture of tonsillitis, and this is of dropsy, accumulation of fluid in the tissue space. Female symptoms of Dulcamara. Menses, watery rash appears on skin before menses. Dysmenorrhea with blotches all over. Herpes on mammae in nursing women. Mammae injured, hard, sore with absence of menses and leukorrhea. Menses, milk, logia, suppressed by cold. Eruptions on skin after weaning. Respiratory symptoms of Dulcamara. Cough caused by tickling in the back of throat. In prolonged fits with much loose, easy expectoration after physical exertions. Winter cough. Pain in left chest as if lung moved in waves. Not moved actually, as if lung should have been moving in waves. Neck and back symptoms of Dulcamara. Neck stiff, pain in small of back. Small of back is a technical term. It is actually lying in the lumbar region, L3, L4 region, small of back. This is a technical term. After a long stooping, lumbar region and sacrum. Note this figure here. The sacrum is this finishing portion of this vertebra. This is vertebra. Cervical vertebra, thoracic vertebra, lumbar vertebra, and then finally sacral. This is sacrum, and above sacrum lies the lumbar vertebra. Feel cold. This area, lumbar region and sacrum region, this region that is on the skin, there will be sensation of cold. Extremity symptoms, Dulcamara. Exostosis on arm. Exostosis means actually bone growth. Exostosis, bony tumor or bony growth on arms after suppressed stitch. Palms sweaty. Trembling of right arm with urinary difficulty. Rheumatic symptoms alternating with diarrhea and acute eruptions. Warts on hands and finger. Note, warts on the hands or finger, swelling of calf of leg. Skin symptoms of Dulcamara. Eruptions, scaly, thick, crusty, moist, bleeding or herpetic. Worse before menses. Urticaria better from cold, worse from sour stomach. Urticaria better from cold, worse from sour stomach. Worse large, smooth, fleshy, flat. Pruritus, pruritus actually itching. Thick crust all over body. Rash in newborn, ringworm in the hair in children, eczema in infants, small furuncle on places of heart. This is eczema infant's face. Fever symptoms of Dulcamara. Coldness in different parts. Icy coldness of paralyzed parts with pain. Chill starts in the back, not better by one. Worse in the evening. Chill with urging of stool or urination. Foul sweat. Complementary medicines, Barita carb and atom salve. Related medicine, Rastux. With this, the video ends. Thanks for listening and viewing. Any problem, write it in the comment section. I would attend.